Buxton, President and CEO of McLaren Health Management Group. Thank you so much again for joining us today. Ahead of the Global Health Expedition, we're so excited to have you join us as an esteemed speaker this year. As you know, the theme of the conference this year is Invest in Health, which can mean so many things. I'd love to know from your perspective what Invest in Health means to you.
As I reflect on investing in health, it's really a multifaceted approach that both incorporates the provider, it incorporates the payer, and it incorporates, most importantly, the patient. And I think all three aspects of that triumvirate really need to come together to create access, not just for people, but also around people. Because oftentimes when we think about investing in health, different populations have more difficulty than others do. So I think about how you invest to create access as a provider. I think you have to take ownership as a patient. And I think you have to think about all the different ways that payers have to come together to create an affordable aspect of that delivery of care. So that investment for me is multifaceted and one that really requires people to come together around the prospect of health, because it's not just about taking care of yourself, it's about taking care of others, as well as how providers come together to create access. Because when you need health, you have to have it quickly. And I think creating roadblocks makes it more difficult for people to get the access when they need it. We talk about getting people the right care at the right time. And I think that's truly the investment of all three aspects coming together.
Thank you. That was really insightful. And another important area for us, as well as the access part, is it's important for us to bring together diverse voices from across the globe to offer different perspectives. I know that you get invited to many conferences. What was it about Global Health Expedition in Saudi Arabia that stood out to you and inspired you to travel from across the world and to take part in this event?
I participated in a global healthcare conference in Boston earlier this year. And I was really taken aback when I got into the booth that was provided by the kingdom and listened to the ministers speak and really learn and understand about the ways that the Saudi kingdom is investing in healthcare. I was really impressed, and I wanted to learn more about it, and I wanted to create opportunities to share for things that we've learned here in the United States with other members of folks in healthcare across the globe. I think the Global Healthcare Conference in Riyadh really is a platform where we can all come together, create thought, and have, if that thought resonates, really trying to create deeper connections that drive value, accessibility through cost-effective ways in healthcare. Because what one population is struggling with in healthcare, all populations struggle with in healthcare. This is a universal, multi-global issue that everybody is struggling with right now. And I think the more voices we bring together around it, the better solutions we're going to create. I don't think this is an issue where one segment of the world is different than another. I think we're all in the same boat. I think we come about it potentially a little differently. But at the end of the day, it's really about what we bring to the patient when the patient needs it for the betterment of their health.
Absolutely. And we're bringing so many different nationalities and specialists together for the show. What do you see about the importance of global collaboration in shaping the future of global healthcare?
Well, I think that anywhere you go, you're dealing with a melting pot of people. So we do know that certain diseases and certain afflictions are more focused in certain areas. But as we come together globally around that, I think everybody learns from the work that others are doing. And I think that creates a platform basically worldwide to enhance not only the ability to care for people. Again, we all live in a global economy. It just is what it is. I mean, travel anymore allows people to move from point to point. Obviously, people immigrate to different areas of the world, which I think is exciting. But enable to care for those folks, we've got to open our eyes, we've got to open our ears, we've got to listen to what's happening across the world. I think that, in a small microcosm example, COVID was something that brought the world together around the delivery of care for something that was needed globally. And I think if we could have focused on things like that more proactively than reactively, I think we would have been a lot better off. And I think there's more of that that's going to come. So getting a global scope of it versus having it isolated in different areas really makes a big difference. And I really think that's the way that we need to begin to think about things forward thinking. Most people focus on what's in it for me. I think we have to focus on what's in it for everybody.
Yeah, thank you. And I understand you're leading the McLaren Health Management Group as part of one of Michigan's largest integrated health systems. Under your leadership, McLaren has pioneered telehealth expansion and invested in new campuses like the Oakland Oxford facility. Could you tell us more about how these initiatives are helping you deliver care at scale across such a large network? And what lessons health leaders globally can take from your approach, balancing innovation and access and long-term sustainability?
I think for us, it's very basic. We focus on our mission statement, which is to be the best value in healthcare as defined by quality outcomes and cost. Most folks in healthcare don't like to talk about cost, but it's the base of everything we do. So we take a very, very integrated approach using innovation to help drive access. I think our new campuses, for instance, are located away from hospitals. They offer emergency services. They offer access for patients. And it's a real focus for us to try and deliver care where care is needed and not sort of break the will of the patient to bring them where we need them. I think that's also a big focus of our innovation for telehealth. And we've done some really, really innovative things, delivering telehealth directly into patients' homes, and in places where patients travel. So, for instance, in big cities, instead of having patients have to go to a clinic, we've actually invested in healthcare where large pharmacy chains are. So patients can go in, get complete access to healthcare. It's sort of one-stop shop. They can get the prescriptions they need for their care. All of the care is delivered through a telehealth platform. So it's virtually integrated. So the provider and the patient are having a conversation, not unlike the one you and I are having right now. Makes the patient feel very comfortable. We have integrated devices that we can look in the patient's eyes, ears, nose, throat, take all types of information from blood pressure, weight, temperature, et cetera. So the provider, although not face to face with the patient in person, has all of the access they need. We can do labs, we can do on-site point of care testing. So for the patient, it makes that care not only very accessible, but also affordable and very quick. So in this scenario, no instant lasts longer than 20 minutes. Patient walks out, they have a prescription that's actually ready for them at the counter when they walk up. They've been given a diagnosis that gets put into the electronic medical record that goes directly back to their primary care provider. And again, it's an example of ways that McLaren has used innovation to really drive a platform to get better accessibility for patients when they need it, because it's really about getting care to the patient when the patient needs it and not having patients wait for care. We can follow up with them in their homes, which makes it, again, much easier. And one of our focuses is to integrate when we have a tool like virtual health, we integrate that across every vertical. So we've now integrated into our emergency rooms. We're doing telehealth triage before patients even get to the emergency room so that queue in the emergency room becomes more focused on priority. We know exactly what patients are when they bring themselves in. Obviously, when they come in ambulances, we've integrated, again, a mechanism to where transfusions are done in the field, all the vitals are brought in, and so we have a picture of the patient when they get in, because they say in various types of afflictions like a heart attack or a stroke, time is muscle, and time saves lives. So we've also integrated a virtual stroke network that's actually ranked in top 5 in the nation, where we get patients from all over the state of Michigan to go into our satellites that are having a stroke. We use virtual care to do evaluations, and then if we need to, we medevac them to an area where they can get an intervention that resolves their stroke. And so using various types of innovation like virtual care, like telehealth, this has allowed us to really ramp up our platforms in delivery and open access so that patients don't always have to come directly to one location, but we can deliver that across a very broad platform.
Amazing. Thank you so much. It's so great to hear of all of the innovation that's taking place there. Lastly, could you tell us a little bit about what people can expect from your session at Global Health?
I think as we come together and talk about the various different types of things that are important in healthcare delivery, not only today but in the future, I think we need to spend a lot of time thinking about, how do we treat diverse populations? Because again, understanding your population becomes important. Creating access, using innovation. I think the onset of AI, the onset of virtual care becomes more and more important. And then really trying to come together with other leaders in this area to talk about different perspectives, but really finding out where they intersect and how we create sweet spots for patients, but also for providers and payers. Because again, if those 3 entities don't come together, ultimately we don't get the outcomes that we want, and people are being sort of held back from access to the care that they need.
Amazing. Thank you so much, Buxton. It's been a pleasure to speak to you today, and we're very much looking forward to welcome you on site at Global Health Expedition this year.
I'm
Okay,
excited
so
as well. Thank you.